Hi, this is Cheryl with another movement exploration. This one's in response to a question about, falling forward and wanting to, not do that as much, but also like how to protect yourself, how to develop the reflexes that will help you when you find yourself unexpectedly falling forward. I should say before I show anything, I really don't believe in memorizing like the way to fall because falls are unpredictable. They don't happen in exactly the same way each time. And so I believe in really exploring movement in a kind of repetitive but slow and sensorily rich way so that you're actually developing better reflexes. This is part of my experience in training Aikido as a martial art. We do a lot of rolling and falling, and you want to really wire in to your brain, to your nervous system, this kind of reflexive response when you start to lose your balance. And so for today, we're going to focus on, what happens if that happens when you're starting to fall forward. Generally when we fall forward, we do some sort of bracing movement. We resist the fall in order to protect ourselves. And so it's really helpful to rewire your reflexes to actually agree with the fall, to go with gravity. And so there's a couple little movement explorations that can really help your brain and nervous system and body develop some repertoire about a nice shape, a way to move. And so the first one I want to show is what I call falling from the floor. So coming on your back, keeping your head and your chin towards your chest, great reflex to train to keep your head protected, and to simply slowly come over to your side and come back. And couple things, if we hold ourselves up from the floor, we're going to set up a fall, right? Because we're holding ourselves in tightly in away from the floor, using this exercise to actually, as if you could hug the floor, right? That you could embrace rolling softly, having all of your ribs, your back, the back of your pelvis, your shoulder blades, your arm, all coming really softly to come and greet the ground. And so this kind of slow movement, really helpful to do. If you find it difficult to have your legs up, you could also do it just with a split leg so that you're rolling. But I do recommend keeping your head up and away from the ground. You don't really want to wire in, having your head bounce towards the ground. So this is one, small, smooth exercise to help you with that feeling of embracing the ground, embracing the fall, creating what I like to call a friendly floor. So another one that I like to show is this idea that rather than coming to brace, coming to fall and catch yourself, many women at midlife do this and break a wrist, break an elbow, do something with their shoulder, break a collarbone. So I like the idea of sliding. So I'm just going to come out here a little bit. So this idea that I could slide myself down and come up again from sitting. So couple notes, certainly you can do it with a palm, depending on your past history with your wrist or your elbow, your shoulder. You might want to do it on the knife edge, the side of your hand. That might feel a little bit stronger. So just to practice being able to come down and slide, so that I'll come up a little bit to do this from a slightly higher height, that this impulse to sort of expand out so that you can come into a slide is just a better reflex. You're going with the force of the movement and expanding out. Of course, if you're falling on gravel, if you're falling on something that's rough, that may have consequences for your skin. But I always sort of, there's a triage in falling to absolutely take care of your head, and then see what else you can do to shape the fall to have less dire consequences. So a little bit of skin on loose gravel better than breaking a wrist, falling, hitting your head. So the other sort of very general movement that I like to see and is, rather than falling forward and bracing, to have a sense of coming forward. And I'm going to use this just as a little prop here to bend and bring yourself down. So if you start to lose your balance and you're going forward, to the extent you can get your pelvis back, to the extent you can bend in your knees, then you might be able to come to the floor, but it's not going to be such a big fall. So come down, soft hands, slide. You can roll a bit. So again, I'm a proponent of working on these three pieces together, but to put it all together, once you feel confident, I can do a good drop, I can get my butt out, then I can play with, how is it I'm getting to the floor? How is it I can change the shape of my roll so that in fact I'm moving in some kind of way that doesn't have a big stop sign at the end, doesn't set up the possibility of breaking, so some part of you as you fall. So thanks for tuning in. Have a great movement day.